Hello everyone, welcome back to Med-Surg Mentor. Today let's review a potentially serious infectious disease that mainly affects the lungs, and it is pulmonary tuberculosis. It is a preventable and curable disease which is also world's leading infectious disease killer. Based on CDC fact sheet, in 2020, a total of 7,163 cases of tuberculosis disease were reported in United States. Okay, let's begin. Definition of pulmonary tuberculosis. It is an infectious lung disease caused by Mycobacterium tuberculosis. Next is etiology of pulmonary tuberculosis. The causative organism of pulmonary tuberculosis is a bacteria, and it is Mycobacterium tuberculosis. Risk factors of pulmonary tuberculosis. Common risk factors are weakened immune system in conditions like HIV, diabetes mellitus, and cancer. Traveling or living in certain areas like Latin America, Africa, and Asia. Tobacco smoke. IV drug use and alcoholism. Working in the healthcare field. Living with someone infected with tuberculosis. Use of certain medicines such as corticosteroids. Polluted environment. Malnutrition. And living in crowded conditions. Now let's move on to the mode of transmission of pulmonary tuberculosis. Mycobacterium tuberculosis is carried in airborne particles called droplet nuclei, which is 1 to 5 microns in diameter. And this can be generated from persons with active tuberculosis when they cough, sneeze, laugh, and sing. Types of pulmonary tuberculosis. There are mainly two types of pulmonary tuberculosis, and they are latent and active tuberculosis. Latent tuberculosis occurs when the bacteria in the body is inactive and cause no symptoms, and it is not contagious. But it can turn into active TB, so the treatment is important. Active tuberculosis means tuberculosis bacteria is active and highly contagious. Pathophysiology of pulmonary tuberculosis. Due to etiological factors, microorganism, that is Mycobacterium tuberculosis, enters the body and reaches the alveolar sac of the lungs. At the next stage, it invades and replicates within the endosomes of the alveolar macrophages. As a result of this, macrophages attempts to eliminate the organism by phagocytosis. But it reproduces inside the macrophage and kills the immune cells. Later, Mycobacterium tuberculosis travel to other parts of the body through the bloodstream and lymph. Finally, it results in infection, tissue destruction, and necrosis of the lung parenchyma. Major clinical features of pulmonary tuberculosis are persistent cough that lasts more than 3 weeks, coughing up blood or mucus, chest pain or pain with breathing or coughing, unintentional weight loss, fatigue, fever, night sweats, chills, and loss of appetite. Important diagnostic measures done to rule out pulmonary tuberculosis are blood test, Mantoux tuberculin skin test, chest X-ray, CT scan, sputum test, and interferon gamma release assay test. Major complications of pulmonary tuberculosis are pneumothorax, bronchiectasis, hemoptysis, pulmonary aspergillosis, spinal pain, joint damage, meningitis, liver or kidney problems, and heart disorders. Now let's see some of the preventive measures of pulmonary tuberculosis. They are: ensure vaccination, that is BCG, use mask and respirators in polluted environment, cough or sneeze into upper sleeve or elbow, stay home from work, school or other public places if diagnosed with pulmonary tuberculosis, wash hands after coughing and sneezing, make sure house is adequately ventilated, try to keep patient in isolation, maintain adequate nutrition, and avoid contact with people with low immunity, children and elderly if diagnosed with pulmonary tuberculosis. Next is management of pulmonary tuberculosis. Commonly used antibacterial drugs in latent tuberculosis are isoniazid, and rifampicin, and rifampicin. But in active tuberculosis, drugs used are ethambutol, isoniazid, pyrazinamide, and rifampicin. Nursing diagnosis for patient with pulmonary tuberculosis. They are ineffective airway clearance related to thick and viscous secretions, risk for impaired gas exchange related to destruction of alveolar capillary membrane, acute pain related to inflammation of the lung parenchyma, imbalanced nutrition less than body requirements related to anorexia, risk for infection related to inadequate primary defenses, knowledge deficit regarding disease condition, and fear and anxiety regarding uncertain outcome. Next is nursing care of patient with pulmonary tuberculosis. They are assess respiratory rate, respiratory sounds, and use of accessory muscles, place patient in semi or high follows position, clear secretions from mouth and trachea and suction as necessary, maintain fluid intake of at least 2500 milliliters per day unless contraindicated, humidify inspired air and oxygen, administer mucolytics and bronchodilators, demonstrate and encourage pursed lip breathing, promote bed rest or limit activity to reduce energy requirement, and administer supplemental oxygen. With this, we are finishing the review of the condition pulmonary tuberculosis. It is a potentially serious contagious disease of the lungs which is caused by bacteria, that is Mycobacterium tuberculosis. We have also discussed etiology, types, risk factors, pathophysiology, clinical features, diagnostic measures, complications, management, nursing diagnosis, and nursing care. Thank you so much for watching, and if you find this video helpful, please like, share, and subscribe to my channel. Thank you.